considered a binge drinker. Studies show that 20% of them have major depression. 10% of them have contemplated suicide. And suicide is the second leading cause of death in this population. And suicide is 3 times more likely in drinkers than non-drinkers. So they would say that it's just partying and it's just drinking and we're just having fun, but the truth of the matter is 20% of them are depressed, 10% of them think about suicide. 70% of campus arrests are related to alcohol. 40%, this is important, regret something they did while intoxicated. These are young adults and college students. 30% of them don't remember some of the adverse things they did, such as 30% of them don't even remember having the unprotected sex. They hurt others, they have motor vehicle accidents. A lot of times there's a lot of shameful behavior. Sometimes there's rapes among friends, not uncommon. People while they're drinking and don't remember sometimes in the binge drinking. Physical assaults on their own friends. So they would have you believe, or some people would have you believe that, again, binge drinking in college campus is a social event. But if you look at statistically, 58% of them drank while they were upset about something. 39% drink alone, doesn't sound like a social event. 30% drink when they're bored. 33% have thought about suicide. 40% of the females identify themselves as having low self-esteem or have a history of sexual abuse. So they're really, a lot of them are hurting teens. So when they say it's a social event, for a lot of them it is not that. In this age group, the death rate, secondary to alcohol, is about 5,500 per year. And again, the Iraq War so far, we've lost, I think, around 6,000 at this point. We're losing a lot of young adults, college-age kids to drinking-related illnesses. See from the pie graph here that 19% of them meet the criteria for having an alcohol problem, but only 3% of them are actually seeking any sort of treatment. So 40% of the hospitalizations or admissions nationwide for young adults are related to alcohol or drugs. A lot of the motor vehicle accidents that occur, there's a lot of innocent victims. These are family members, innocent people that weren't drinking. They kill the other people or maim the other people in the car. Again, only 14% of the 19% that meet the criteria ever seek treatment. There's a tendency for young adults to avoid the student health services because of confidentiality reasons. They're worried that someone will tell their parents or something. So this is, I think, an important slide, and we were talking about, Kathy asked about this in a way, not exactly, but sort of what you were asking about. You know, the studies, this is a slide that shows motor vehicle accidents over here, and the number of drinks here. And there's 2 different graphs. There's the young adults. Well, this is colored wrong, actually. The adults are the blue here, and the under 21 are here. And so the number of drinks, depending, if you look at the number of drinks in motor vehicle accidents, young adults, the more drinks they have, the risk of having a car accident goes skyrockets with each drink. Whereas adults, they have an increased risk too, but much lower. So the combination of an inexperienced driver, an inexperienced nervous system, an inexperienced driver, along with alcohol, the combination is really deadly for young adults. You have an experience.
That kind of goes back to the tolerance issue too, that the adults have developed that tolerance and have balanced their system better.
That's true. That's another factor, yeah. But it's definitely a high-risk behavior for young adults. On to opiates. I just got about 3 more slides left. This is about prescription pill, pain, and opiates. Opiates is a big, big problem nationwide. There was this first quote, there's a developing consensus among experts in the pain management field and palliative care field that we really, caregivers, that we undertreat patients with pain. And they're suggesting that it's an ethical, legal problem because we are letting people go untreated in their pain because there's too much fear about prescription opiate abuse. This isn't what my belief is. I'm sort of showing you the other side of the coin. They would say that we undertreat pain because we're overly concerned about prescribing too many pills to people. The other thing that has caused, so that has been a factor in nationwide, the FDA passed a policy in 1997 that allowed all of a sudden for direct-to-consumer advertising about prescription medication. And you all know this. If you think about it, I'm sure the people in the room, you can remember before, you used to see all the advertisement on TV for prescription medication. If you think back to the mid-90s, there was no advertisement on TV for any pharmaceuticals. And then in 97, they passed a law that allowed that. And as a result of that, prescription pills, not just opiates, but all prescription medication, was really increased greatly.
But I'm not sure I recall any opiates, maybe I'm wrong, opiates that are typically advertised on television.
Right, that's correct. It's not.
Okay.
But they don't really advertise opiates on TV, you're right. But the whole concept of marketing and has increased, you know. And the Joint Commission in 1999 passed new standards for pain management that every patient in any hospital for any reason needs to be evaluated for pain. The concept that we were under-treating pain. And again, there's some arguments that that's true, you know, but I'm going to talk about the other side of the coin. Okay? Where do young adults and youth get their pills from? Maybe I'm doing this backwards. Maybe I should show you maybe I'll show you this little in the corner up here. You see this prescription pill abuse as a result of the push to prescribe more medications and to make sure we're treating pain adequately, and FDA regulations, the push to make sure. And since the mid to early 90s to now, prescription pill abuse has taken off. It used to be that illicit drugs was more of a problem. Now, prescription pills is definitely a greater problem. I'm going to come back to the slide in a minute. Friends and family are the most common source of prescription drug abuse among youths. In other words, from y'all. Kids are getting drugs from y'all. Okay? Where? Well, about half to third report who have abused prescription medication in the past year say they obtained it free from family or friends. Medics and captains. Friends give it to them. Second most common source for a lot of them is drug dealers or the internet. People are buying a lot of drugs off the internet. A lot of times with the opiates, the most common is they're getting it from a physician. Okay? That's where they tend to get their pills from. And this shows the change in opiate addiction since the early mid-90s. It used to be that there were 800,000 heroin addicts and 240,000 on methadone. And nowadays, there's estimated to be about 600,000 people on buprenorphine, which is a substitute for methadone. But prescription pill abuse has just skyrocketed, as I talked about. There's 6 million prescription pill addicts nationwide now. And what happens with the young adults is one of their friends gives them some Oxycontin, okay? Powerful, potent, highly addictive opiate. And they so they're partying a little bit. But you know what? That Oxycontin is very expensive and hard to come by because it's expensive. It's a Schedule II medication, hard to come by. So they switch over to something that's a little easier to get, hydrocodone. And then, you know what? Hydrocodone is not nearly as expensive or hard to get as Oxycontin, but it's still expensive and hard to get. You know, you can get heroin for even cheaper and easier. So after you get addicted, you gravitate towards heroin. And so the young adults are snorting and shooting up heroin still. HIV and hepatitis C, highly correlated with opiate usage. And it used to be, you used to hear so much about HIV being related to intravenous drug usage. Now very little of the HIV